So firstly, who is INS? INS actually originally stood for Illawarra Nursing Service. That's our heritage. Back to the early 1980s, we were one of the pioneers of nursing services in the community. The first to be contracted by the Department of Veterans Affairs, by government. We pioneered a whole heap of in-home services, from nursing services to home assistance services to spinal care services, packaged care and the like. So we were pioneers in a lot of ways. And again, that started in 1984. We started Illawarra Nursing Service. And as we grew, we ourselves were buying services such as what we're going to talk about today. And as health carers, we had a problem with both the services that were being delivered, which were ostensibly being delivered by security companies back then, as well as the technology, which was no different to your home security system. So from a healthcare perspective, we thought, well, we should be about prevention and providing some health services rather than just looking at it as a home security system being monitored by security guards. So we created INS LifeGuard. That was another division within the group, and that's what I'm here to talk to you about today. We also develop technologies under INS Technology Services. We also operate INS Care Call. We do a lot of different things, but essentially our DNA is health. That's who we are. In fact, when you're talking to our health centre, we are staffed by healthcare professionals. We don't use security guards or school, people leaving school, and with a first aid attendant, we don't do any of that. Okay, because our belief is we should be about providing services that are health related and preventative services. And that's how we got into INS LifeGuard. And as things grew, we ended up developing our own technologies. Again, why? Because we wanted to provide more for less. That's really why we did it. And as health carers, we're always striving, I think you'll agree, to provide more within budgets. We've always got budgets. We're always limited by funding. So we wanted to get out there, deliver some technology that was going to be able to provide some additional services, but at a cost base that would make it affordable within what people were paying before. So our centre is, as I mentioned, health related. I'm going to talk to you about medical monitoring today, but it's important that you know what our point of difference is, and it really is our services and who's driving it. If you're talking to us, you're not talking to, as I said, security guards or school leavers, unqualified people. We're qualified, okay? So you're talking to, at a minimum, nurses, okay? Now, to explain to you the skill sets in our centre, up until recently, if you were to call the after-hours doctor service in the Illawarra, you're talking to us, okay? That's recently been bought out by a big international conglomerate. We provide employee health services. So think of the big airlines. If their pilots or cabin crew get injured, we look after them. Paramedics in Victoria, they get injured at work, report their injuries to us. We do a whole heap of things. It's because we're a big centre, we've got healthcare professionals on site, and we're able to do all of these health-related services. We don't wait for there to be an emergency. In fact, we don't like that. Even though we're an emergency service provider, we'd rather it not be an emergency. So we encourage you to tell us if there's a problem before it, becomes an emergency. I'll give you an example. How often I've heard the tale of someone having had a heart attack only to be told that they had chest pain for hours. And so why didn't you let anyone know? I didn't want to bother anyone. I didn't think it was serious. Yeah? Well, we want to be bothered. We'd rather deal with it at the get-go than you having to send through an emergency call. right? We want to try to prevent that from happening. So this is really the safety net. As health carers, we believe in prevention. If there is an event, and I hope that you don't have to, use it, but if there is an event, we will follow you through that event as best we can through the hospital system till you get home, and then we may make outbound calls to you. You know how in hospital you get observation visits at your bedside? We do the same thing. Just because we're doing it remotely doesn't mean we should change our systems. We don't. If we were looking after you in your own home, we'd send someone out and do an observation call. We do that. So if you're coming home from hospital, unfortunately these days we see a lot of revolving door. Within the week you're back in hospital because they let you out very early these days. Okay? So we'll try to prevent that by making outbound observation calls on you, and that's not limited, that's determined by the triage nurses. Okay? So we want to know if you're not well. If you're not well, we'll check on you. Obviously with your permission. Well, it's always with your permission, but we'd like to get involved at the get-go, at the very beginning, rather than wait. So we're available to you 24/7. So if you've got a question about your health, you may have gone to the doctor and he's prescribed something as an example. I do it all the time. I go there, I can't wait to get back out. And then I've been prescribed and not asked, well, what is it? Are there any side effects? Yeah, well, you can call us. And if we need to consult with your doctor, we will with your permission. Okay? We do what we would ordinarily do as community care providers, albeit remotely, through the call centre, because obviously we're not physically in your home. The services is what makes the difference. Our DNA is healthcare, and we're there for you. Should you need us, we're a phone call or a press of a button away. And it's an included service. We don't charge you additional costs. With your permission, we're going to carry a lot of your medical details and your medical history. We're health carers, remember? So we have that. So if there's a problem, we can pass that on and we can better deal with the situation on your behalf. The more you give us, the better. And it makes a difference. I'll give you an example. If you have a fall, unfortunate, you trip and fall or whatever else, and you tell us, the response may vary greatly. For instance, if I know you're on warfarin, you're going to get a different response. Okay? And that's the importance of us knowing that information up front. Another example, you might call us and say, you've got a splitting headache. Now, for me to roll services to that, you may get like what we call in the industry, a cab. Okay? No bells and whistles, they'll come when they can, whatever. It could take a long time. But if I know you've got a history of TIAs or stroke or something like that, or that may develop into something more sinister, I need to change the response from services. So you'll get a different response. So we need to monitor all that. And we do. So if you touch that, it'll send through a help alarm to us. Now you can also trigger an alarm by a variety of different ways. You can wear these. These are portable transmitters that can be worn around the neck or the wrist. Very small, very lightweight. So these things are portable. They're waterproof, so they can be worn in the shower. In fact, in villages where there are pools, swimming pools and gyms, we put them in those facilities on racks. So when the residents come in, they put this on and go swimming. Why? Because if you're in trouble inside the water, I don't think there's much point in having a button on the wall. So you have it on. Same as in a gym. Really risky areas. People are exercising, they may be, particularly if they're alone, so they sign them out, put them on before they use those facilities. Again, it's that system I was talking about. We need to provide coverage for the what-ifs. It's like buying home insurance, right? You want to make sure they pay out. If there's a problem, it's got to work. So these things can go in the bathrooms and around your homes. They're static. They're not hardwired, they're battery operated. We also do monitoring of smoke detectors. There's also sorts of different devices that you can program to this, and it also includes telehealth products. So what do I mean by that? You can take your temperature, it'll send the readings to here and upload it to the nurses in the call centre. It will also send an alert to your family if that's the way you want it. All sorts of things can be, it's a health device. I don't want to get, they're the things you can add. We're doing much more than just emergency response. The device is to provide wellness in your home. Remember what I said earlier? I don't want to get bogged down in the technology because the technology just enables us to do stuff. The important bit is the services that you'll be using. There's an app you can download to your own mobile phone. What's the difference between that? Not much, it's the same. The difference is if you're out and about, we need to find you. There's GPS in here. We can locate you. Still got two-way voice comms, still the same sort of features. Okay, so that goes with you away from home. We also have, but there's things like this. That's a mobile pendant, one button, and it'll tell us where you are and we can talk to you through here. And overnight, pop it in the cradle. So there's all sorts of different devices you can use.